Hi, this is a presentation on the randomized clinical trial of how multifaceted podiatric intervention, including footwear, can be used to prevent falls in older people. The underlying issue that is the catalyst for this clinical trial is a public health concern of falls among community dwelling of the elderly who are 65 years old and over. Statistics show that 1 in 3 of those in this age group will experience a fall in a calendar year. Factors that contribute to falling are interactions with environmental hazards and physiological factors such as impaired vision, muscle weakness, and slow reaction times. However, more recently, foot problems have been associated with falls associated with older people. In specifically foot pain, reduced range of motion, toe weakness, and deformities have shown to be risk factors contributing to falls. As well as inappropriate footwear is another risk factor, which includes walking barefoot, walking in socks alone, or shoes with inadequate fixation and support, heels with increased height, and limited contact surface area of the sole. The underlying reason for conducting this clinical trial was that given emerging evidence that foot problems and inappropriate footwear increase the risk of falls, the only intervention was prevention guidelines, which one implemented with a visit to a podiatrist to have their feet and footwear examined. But these guidelines do not specify the assessment or interventions carried out, yet randomized controls have been carried out to confidently determine foot problems and footwear are major risk factors in falls. But these guidelines lack the criteria of when to refer to a podiatrist was necessary, nor were there any analysis of the effectiveness and benefits of such referrals. So the search strategy and the research question results, we used the PICO guideline, which our population was older people, 65 years old and over. Our intervention was podiatry interventions. Comparison was placebo, and our outcome was obviously to prevent falls. So the PICO question that was derived was, will a podiatric intervention be effective in preventing falls in older people? To acquire the most relatable study to our PICO question, we used podiatry with the Y being replaced by an asterisk, and intervent with an asterisk followed by, and prevent fall with asterisks followed after each word were searched individually through Medline. They were then searched, and which produced a total of 5 results. From these, the most relatable article was chosen as being the effectiveness of a multifaceted podiatry intervention to prevent falls in community-dwelling older people with disabling foot pain, a randomized controlled trial. This article included the population, intervention, and outcome for our PICO question. It is a randomized controlled trial published in 2011, therefore proving it is relevant and a higher level of evidence supported. We used the Pedro scale to critically appraise the intervention study. It consists of 10 elements to assess randomized control trials for their internal validity. It's given a score out of 10, and the higher the score, the more sufficient statistical information are to make their results accountable. The first element is the eligibility of criteria was specified, which is shown in method and trial design, page 2 of 8, and diagram flow of participants through study on page 3 of 8. Number 2, random allocation was shown in methods under trial design and in figure 1. Number 3, allocation was concealed was shown under randomization page 2 of 8. The fourth element, similar groups regarding important prognostic indicators, is shown on outcomes page 3 of 8. Number 5, blinding of all subjects is shown under discussion, strengths and limitations of the study, first paragraph. However, due to the nature of the intervention, it was not possible to blind participants in group allocations. Number 6. Blinding of all therapists who administered the therapy is shown in trial design, page 2 of 8. Number 7. Blinding of all assessors who measure one key outcome is shown under trial design, page 2 of 8. Number 8. Measure of outcome obtained more than 85% of subjects is shown under trial design, first paragraph on page 2 of 8. Also shown in the flow of participants through study diagram, there was a 15% dropout in the intervention group. Number 9. One key outcome was analyzed by intention to treat, is shown under statistical analysis, first paragraph, page 3 of 8. The 10th element provides point measure of variability, is shown under discussion and primary secondary outcome measures in table 1, page 4 of 8. Overall, the Pedro score is 9 out of 10, meaning it has internal validity. The result of key outcomes, as outlined in the article by Spink et al. 2011, demonstrates significant improvements in the intervention group compared to the control group. The confidence interval for the reduction of falls was 0.41 to 0.91 with a p-value of 0.01. This is statistically significant, as the p-value is less than 0.05. The 95% confidence intervals for the proportion of fallers was 0.66 to 1.08, with a p-value of 0.19, and for multiple fallers, 0.38 to 1.04, with a p-value of 0.07, both indicating that they do not have statistical significance. The median number of days for the first fall during follow-up was greater in the intervention group at 85 days compared to the control group at 64 days. This shows that the intervention group were able to go for longer periods of time without a fall than those in the control group. When testing the intervention group and control group for domains of strength, range of motion, and balance, those in the intervention group performed better. The combination of these factors allows significant differences for reduced amount of falls. The results show that multifaceted podiatry is an effective fall strategy in older people with disabling foot pain and increased risk of falls. The intervention is inexpensive as the patients are given the exercises to complete and is relatively simple to implement. In additional evidence, many studies have shown how orthotics and prosthetics can improve suffering of patients, but also can improve gait movement and analysis. In majority of cases, pathologies can be attributed to incorrect footwear choices. In one study by Yalla found that improving footwear and adding orthotics had immediate impacts on foot-ankle stability and contributed to postural stability, which in return reduced the incidence of falls. In Gillespie's 2009 study support statements made in the article by Spink et al. That improving footwear support using orthotics, coupled with maintaining podiatric interventions such as advice, home-based exercises, and education. The results were shown to be statistically significant as the treatments showed reduction in the risk of falling as well as the rate of falls. This can be considered as high evidence as it was conducted as a systematic review with high reliability and validity in the research conducted by Cochrane. Whilst not the preferred option, if issues persist with falling and not acquiring balance, surgery can be attributed to improving the risk and rate of falls. A 2013 study found that hallux valgus surgery showed statistically significant improvement to balance with a p-value of less than 0.05. Tai Chi was also suggested to decrease the risk of falling as it will improve muscular coordination as well as balance. Overall, the study has proven to be beneficial to the intervention group. However, there may be issues with compliance to the intervention program. The commitment of 3 half-hour exercise regime may not be followed by all patients. This would be dependent on the individual receiving the treatment, however. Apart from there are no apparent risks to the podiatric intervention being implemented. With very little risk, there were multiple benefits, with the intervention being easily implemented and affordable. The foot orthosis given to the intervention group were prefabricated, thus is cost-effective than that of customized orthotics, therefore being more affordable for the elderly. Furthermore, the home-based foot and ankle exercise is relatively simple to follow as the program is designed for the patients. From the results, key outcomes and additional evidence, it was decided that we would recommend the treatment of a multifaceted podiatric intervention to prevent falls in older people. One of the main outcomes was seen was that the reduction in falls is likely to be related to the improvements found not only just having orthotics, but the foot and ankle strength, range of motion, balance, functionality ability was improved through the exercise regime. The intervention group showed greater improvements in these areas which ultimately reduced their risk of falling. This program can be implemented through the home-based exercises which is free to patients once they receive their program and can be completed in their own time. Therefore, would highly recommend these programs to prevent falls. Lastly, our recommendation, and thank you for listening.